Okay, good morning, student, once again. So I'll directly start, okay? So whatever, like the remaining part it was, so we'll just continue with that. So up to how much we have discussed? Up to 111, right? Again, silent. I don't understand. 111, isn't it?
Yes, ma'am.
Okay. Okay, so let us move fast. So next is and infections in any part of the urinary system involving the kidney, ureter, bladder, and the urethra is known as the option is this UTI, urinary tract infections. So this was the answer. So if there is any kind of infection in any part of your urinary system, okay, infections means if there might be infection in your kidney, in your ureter, bladder, urethra, okay, if any kind of infections occur in your urinary system, that indicate that there is a urinary tract infections. So option 1 is correct. So these are all my notes. So next one, a multi-system disorder, of unknown etiology. Just wait a minute. What is multi-system disorder? Multi-system disorder. Srijana, explain what is multi-system disorder. Multi-system disorder.
Ma'am, which can affect multiple organ systems
Yes,
together.
very good. Multiple organs at a time, is not it? So, okay. A multi-system disorder of unknown etiology, which is characterized by development of, who's that? Please off your audio, whoever it is. Tumpe, you can just off, mute yourself. Okay. So let us repeat again. So a multi-system disorder of unknown etiology, okay? There is a multi-system disorder, but with unknown etiology, which is characterized by development of hypertension, and that hypertension is to the extent of 140 by 90 mm of Hg or more. It can be more than that or more, along with proteinuria after the 20-week, okay, in a previously normotensive and non-proteinuric woman is known as. So this was the definition of which kind of problem, which kind of disorder, which kind of disease. This was the definition of which this. It was the definition of eclampsia, right?
Yes, ma'am.
Yes, ma'am.
All of you, it was the definition of eclampsia, right? All of you.
No, ma'am.
Or then what is the answer?
Eclampsia.
Pre-eclampsia.
Ma'am, it's preeclampsia.
Okay,
Yeah.
it is pre-eclampsia. So now, Virginia, please explain what is pre-eclampsia, what is eclampsia. Hurry up, we'll move fast. Because in the question, it might come at the definition. I might put the definition of eclampsia over here, and you have to choose the option. It's not it. So you never know. So you have to know what was eclampsia. Difference between these two. Just tell me. Virginia. Virginia, do you know the answer? If no, I will pass the question to Nafisisa. Okay, Nafisisa, let's tell me the answer.
Preeclampsia, it's the most important disorder, multiple organ disorder. It is
Okay.
associated with high blood pressure that is above 190 by 140 by 90 mm of Hg.
Yes.
This is associated with proteinuria. Then the blood pressure will be diagnosed after the 20th week of gestation.
Okay, good.
And eclampsia, it will have all the symptoms of preeclampsia and along with convulsion associated with seizures.
Oh, very good, very good. Okay, Nafisisa, thank you. Okay, so all of you, are you clear? What is the difference between pre-eclampsia and eclampsia? If I put the definition of here, both the eclampsia and pre-eclampsia, will you be able to differentiate which one is eclampsia, which one is pre-eclampsia?
Yes, ma'am.
Yes.
Okay, Divyaji, do you understand?
Yes, ma'am.
Okay, okay. So in preeclampsia, Nafisa I have explained very nicely, is not it? In preeclampsia, what will have, a person will have all kind of these symptoms, is not it? Hypertension, all this proteinuria, everything you will have. But one thing that will not be there in preeclampsia is that the woman will not have convulsion or seizure. Whereas in eclampsia, that is the every symptoms of preeclampsia. Okay, whatever symptoms you get in preeclampsia, the woman will have that symptoms, but along with seizure. Seizure ka matlab convulsion, that is abnormal shaking of the body, will occur in eclampsia. That is the difference. So that is why in the given definition you can directly differentiate between these two, for which option A is the correct answer. So are you clear? 112 and 113 question. Are you clear?
Yes, ma'am.
Okay. Okay, next, let's move on. Next question is 114. So see the question of 114. Consequences of urinary obstruction include structural changes in the lower urinary tract as a result of increase in pressure opposing normal urine flow, causing which one of the following? So the answer is both the obstructive nephropathy and then it is hydronephrosis. So see the question nicely. The consequences of consequence to पता है ना सबको उसका मतलब क्या है? Consequence of urinary obstruction, okay, include the structural changes in the lower urinary tract. That means there will be some structural changes in the lower urinary tract as a result of increase in pressure opposing normal urine flow, causing which of the following? So it will all these the following it will cause, that is it will cause obstructive, it will lead to obstructive nephropathy as well as also hydronephrosis. So you know now what is hydronephrosis? What is hydronephrosis? Hydronephrosis? Anyone? Hydro means what? Hydro. हाइड्रोनेफ्रोसिस. हाइड्रो सुन के क्या पता चलता है, दिमाग में क्या आता है? हाइड्रो, HYDRO.
Water.
Yes, very good. So hydronephrosis. So you know na nephro means related to kidney. So there will be excessive fluid present in the kidney. Okay. So that is known as the hydronephrosis. Excessive fluid accumulation in the kidney is known as hydronephrosis. So these are the following causes. Okay, so if there is any urinary obstruction, okay, that means the consequence of urinary obstruction will include all this. Means if a person have urinary obstruction, then all the consequences that you will get are there will be change in lower urinary tract. Okay, there will be change in the lower urinary tract as a result of all this increase in the pressure that occur. Okay, increase in the pressure that opposing the normal urine flow, and then ultimately causing the following problem: this obstructive nephropathy as well as hydronephrosis. So option A and B are the correct answer. So this is all about the causes or the problem that can be faced if a person have urinary obstruction, which is associated with this increase in pressure, okay, that oppose your normal urine flow. So that is all about 114 questions. Now coming to the 115. A patient having swelling of leg. A patient having swelling of leg, that is edema, swelling of the abdomen, that is ascites, with difficulty in breathing, and scanty urine and protein in the urine also. What will be the probability? So what will be the answer? Question is very easy. Read the question nicely. Read the question nicely. A patient will have swelling of the leg, means patient ka edema hoga, and then the patient will have ascites, that means swelling in the abdomen. Obviously all this problem when you used to get, when there is some like excessive failure of this kidney and all. Now when there is excessive failure of the kidney, what we get is that when a person comes to the stage of chronic renal failure, okay, chronic kidney disease, means like it's not like normally the tumor or cyst present, it's not like that. Like हमारा शरीर पे पानी कब जमा होता है, means when excessive fluid accumulation occurs in our body, when our kidney doesn't function properly at all, it's not it, then where it will excrete all those things, well, filtration and all, where it will take place, there is no like other process. So instead of excreting out the waste product, it will remain in our body. That means that will let us to the swelling or excessive fluid accumulation in our body. So that happen only when you have chronic kidney disease, okay, when you have excessive problem in your kidney. And then swelling of the abdomen, ascites, obviously I keep on explaining this, I mean pet full jata hai, abdomen full jata hai. When your kidney is not functioning properly, you will have all this swelling of the abdomen. It is also considered as edema, okay, this is ascites. And you will सांस लेने में तकलीफ होगा. Obviously when there is so much of fluid accumulation in your body, you will have difficulty in breathing, okay. And then your urine will be scanty urine. So you know now what is scanty urine? Scanty urine, scanty. What is scanty? Scanty urine. Scanty urine. You know what is scanty? Scanty urine. Scanty, you know what is scanty meaning? Any one of you? Srijana, what is scanty?
Ma'am, don't know.
Scanty means smell, okay? Means your urine will be very smelly, scanty. Scanty meanings means smelled, okay? There will be scanty urine. So all this you will see, scanty urine. And then the protein in urine, that is proteinuria. Obviously when the kidney is not functioning properly, we have faced all this problem, okay? So what will be the probability now it is asking? So the option one is when a person have chronic kidney disease, he will have chances of having all this problem. So is it correct? Chronic kidney disease, when a person have chronic kidney disease, will he face all this problem? You will have swelling, you will have all this problem. So option A. See nicely. Chronic kidney disease. All of you?
Yes, ma'am.
Okay, very good, Vajit. Okay, chronic kidney disease. Okay, obviously, if your kidney is failed, too much failed, it's not acute also, it's chronic, it's not it. बहुत ज़्यादा हमारा kidney damage होने से तो obviously will have all this problem. Next, chronic kidney disease and this chronic renal failure, these two are the same thing, okay? So don't get confused. So these all questions are made in order to make you all confused. So when it's all the tricky question, okay? So chronic renal failure का मतलब क्या है? Chronic kidney disease, that means chronic kidney failure. So all these are the same thing. So that is why option A and B are the correct answer. So tumor of the kidney is not the correct answer because when you have just a tumor in your kidney, that will not like indicate that you will have like edema, you have swelling over the abdomen, you have difficulty, all these symptoms. Now whatever is being discussed, this cannot be occur just because of the tumor that is present in your kidney. This occurs mainly when your kidney is so much damaged. So that is why option A and B are the correct answer. And this A and B both are given in option D. That is why we choose the answer as option D. So are you clear? This?
Yes, yes.
Yes.
Okay, let's move on. 15. Read the 16 questions. So with the following symptoms, what may be the possible causes? So this was, I think, your like this 7 question or what, I don't know. With the following symptoms, what may be the possible causes? So symptoms are fever. So see the question nicely, okay? The symptoms are given, okay? The symptoms are given over here. And then, so let us see the symptom. The symptoms are fever along with chill, okay? And rigors and gradually subside with sweating. So, and then burning sensation of urine with lower abdominal pain, feeling of thirst, you will feel thirsty, and drowsiness. So all these symptoms are present, okay, in a person. So what will be the causes for the occurrence of these symptoms? So let us see. It is because of, if a person have urinary tract infections, if a person have urinary tract obstruction, if he have this nephrolithiasis, and or else all of the above. So the answer is option A. Okay, so means if a person have like a urinary tract infection, okay, when there is a urinary tract infection, so what happened is that so these are the symptoms that arise. Okay, a person will have, obviously infection hone se to fever hota hai, a person will have fever, so a person fever along with chill and rigors, and then it will gradually, slowly and steadily, gradually it will subside with sweating, means when you sweat it will subside, and then burning sensation of urine, like, and then with lower abdominal pain, and then feeling of thirsty, you will feel very thirsty, and then drowsiness. So all these symptoms are mainly because of the causes of urinary tract infection. So that's why option like A is the correct answer. Actually, like when we discuss about urinary tract infection, there are like uncountable of causes, uncountable of symptoms. ऐसा नहीं है कि you got this much of notes, so only this much are the causes. It's not like that. In this world, there are so much of like causes and symptoms, okay, which can affect this. ऐसा नहीं है जो है like whatever you got notes, only that one. It's not like that. Thousands, and we can't give everything. So, but you should have idea about all those things. That means you should relate and try to think that, oh, this a disease, what are these symptoms can occur. So you should use your common sense in that case. So this was all about 106, and 107 is a person with daily fever for last 1 month, and then hematuria and pain during micturition. He is losing weight also. Culture of urine fail to show growth of any organisms. So this person is probably having which of the following? So here, this is renal tuberculosis. So this question is not like required for you all, because this is not in your this syllabus. Okay, maybe it was, maybe previously it was, but for now it is not in your syllabus. So which I already sent you all now. So but just in case if you want to know it, then you just know it. Means what does the question mean is that a person with daily fever, okay, for last 1 month, or within that last 1 month he have continuously he have fever, okay, daily, every day he have fever, and he also have hematuria, okay, and then he also have a pain whenever he urinate, he have pain, okay, as well as he is also losing weight, so much of weight daily within the last 1 month. And then when there is a culture of urine, okay, when they're doing a culture of urine, means like urinalysis, when they did, after having all this problem, okay, they just take a sample of his urine and they have done it for investigation, but they find that they fail to show growth of any organism. So in his urine they did not find any kind of organism present, that in spite of having all this problem. Okay, so this person is probably having which of the following? So it's he or she is having renal tuberculosis. So if in case if you want to know it for future, you just know it this 107. So are you clear with 106 and 107, 116 and 117?
Yes, ma'am.
All of you?
Yes, ma'am.
Okay,
Yes,
all
ma'am.
these are like previous year questions. Okay, like you never know which questions will come. So that's why these are all made on or already by Dr. This Arab sir. So it's very important. So see this question 118. Okay, so a person after passing 5 times of loose motion develop passing of scanty urine with drowsiness. nausea, vomiting, and metabolic acidosis. Your immediate line of thinking will be pre-renal failure. Okay, you will have a pre-renal failure. So this is very interesting. Okay, a person after passing 5 times of loose motion, उसका loose motion हो रहा है, okay, 5 times हो गया. In a day, he already have 5 times of loose motion, and then it means having loose motion associated with that of scanty urine. Okay, he also will have a scanty urine. He means his urine will be very smelly, and then with drowsiness, and then he also have nausea, vomiting, and as well as metabolic acidosis. Okay, so the immediate thinking line will be he might or she might be suffering from pre-renal failure. So that's why option A is correct. So only renal failure cannot like let a person have this kind of problem. Okay, only the renal, because renal failure means what? Kidney failure. It can develop so many kinds of like problem, like related to edema, the societies, all this. So that is why pre-renal failure is the options for 118 questions. So next 119. From the last 8 months, a person is passing less urine with pedal edema, breathlessness, and drowsiness also. On examination, his glomerular filtration rate is 70 ml per minute and urine show mild proteinuria. Your probable diagnosis will be, so the diagnosis will be like maybe he's suffering from like this chronic renal failure, maybe he's suffering from 2nd stage of renal disease, or else he might be suffering from acute renal failure. So what is the question meaning is that from the last 8 months, okay, already 8 months, just imagine almost 1 year. From the last 8 months, a person is passing less urine. 8 months से उसका वो यूरिन पास कर रहा है लेकिन बहुत less amount से, with pedal edema as well as with this breathlessness. So what you do, you know what is pedal edema? You have edema this in your applied anatomy, I think so. Please tell me what is pedal edema. You have this as totally as a chapter. Pedal edema, you don't know, seriously? Can anyone tell me what is pedal edema? Anyone? Hurry up. Finish
Ma'am,
up
accumulation of fluid in the foot or the ankle.
in the
Foot or the ankle.
yes, like there will be accumulation of fluid in your feet and your lower leg, is not it? So it's correct. So just try to know this from pedal itself. All this edema you will see from the last 8 months, a person will have this type of problem. Okay, he will pass less urine, he will have like accumulation of fluid over his feet, over his lower leg, he will have all this kind of edema, and even he also will have breathlessness, difficulty in breathing, and drowsiness. Drowsiness means what? Drowsiness means that you will feel like dizziness. All these are drowsiness. Okay, all this problem he will face within the last 8 months. And then on investigation, on diagnostic evaluation, so we find that his glomerular filtration rate is 70 ml per minute. Okay, means 70 milliliter per minute, and his urine also will show that there is a mild proteinuria. So if in the examination, if you find that a person GFR is 70 ml per minute and his urine also, there is a protein, slight protein, less protein in his urine. So these cases can diagnose which type of like diseases. So the diseases will be chronic renal failure as well as 2nd stage of renal disease. Because when you have like the chronically, when you have renal, chronic means what? It is a slow process. It lasts for many years, understand? So that's why like all this problem, it can be a chronic renal failure, and it can also lead to 2nd stage of renal disease. So acute renal failure means acute का मतलब क्या है? Acute means like it doesn't last long. ना acute means like not much. It's not severe. So last 8 months का मतलब है कि it's almost 1 year. So that means it relates to chronic renal failure. So 2nd stage of renal disease. That is why option D is correct. Both A and B are correct. So that's all about 118 and 119 questions. So next is 120 and 121. So one of you please read these 120 questions. 120 question. One of you read out these 120 questions. One of you read out 120 question. Rifen, can you please read out 120 question?
Yes, ma'am.
Srijana, please keep on taking attendance.
If a person comes to you with fever, frequency of micturition, dysuria, suprapubic pain, and stranguria, his urine is fishy, odorous, and cloudy, what investigation will you suggest?
That's very good. Okay, thank you. Okay, next we will see this. See, if a person comes to you, okay, like if a person comes to you with fever, he said that ma'am, I have a fever and I have a frequency of micturition and I have dysuria, and then there is a suprapubic pain, all this complication, and strangury, all this complication I have. He will come and complain all this complication he have. And then even in his urine, okay, even in his urine, there is a fishy odor and cloudy, means his urine is not clear, it is a cloudy bubble like formation is there in his urine. And fishy odor means his urine is smelly, it indicate the scanty urine, okay, fishy odor, uska urine bahut smell hoga. So all this kind of like problem a person have. So if he have all this problem, so what investigation will you suggest to that person if he comes to you? So you have to suggest that means you have to suggest him that you bring a sample of your urine and we will go it for investigation. Obviously, if he have this problem, then you suggest him to take urine. It's not easy to collect his urine. So urine culture and sensitivity test should be done. So option number A is correct. And then you will suggest him to undergo this routine examination of blood. Okay, obviously diagnostic evaluation method, we check everything. It's not it whole body checkup like blood test, urine test, all this, and then ultrasound of the whole abdomen. Because why there is a fishy odor, why his urine is so smelly, why his urine is so cloudy, is there any problem in his abdomen or what? You have to do check all this whole abdomen. This investigation of also you will do through ultrasound. So all this investigation you can perform, understand, in order to like diagnose the problem, why these symptoms occur in a person. So that is why option D is correct. So do you understand 120 question? What does the question mean and what is the meaning of the option? All of you?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay, it's very easy, all these things. Okay, you just need to understand and then bas dimag lagana hai, just that is the main thing. So what is the next question? Is there still time remaining? Okay, we might not be able to. Okay. If a person comes to you with pain, Ilasara, please read out the question. Your voice is loud.
Yes, ma'am.
Yeah, read
If
out.
a person comes to you with pain in the abdomen, which arises in the back and radiates to the lower part of the abdomen,
Okay.
frequency of urination also increases,
Okay.
but he has no fever or any other previous history of abdominal pain, your line of presumption should be.
Okay, Ilasara, thank you. Okay, let's move on. So what does the question say? This is also again very easy. This, if a person comes to you, okay, with pain, if a person comes to you in front of you, he say that I have so much of pain in my abdomen, okay, and this pain arises in the back, okay, is so much of pain in the abdomen, and that pain will like arise as well as in the back also there will be pain, and that back pain again it will radiate to your lower part of the abdomen, okay, that pain will radiate to the lower part of the abdomen, and the frequency of urinating means whatever he urinate, the frequency of urination also will increase, okay. But all this problem he will have, but he will not have any sign of fever. He won't have any fever. So obviously अगर urinary tract infection वगैरह होता, अगर urinary tract infection होता या फिर कुछ obstruction होता, so because of obstruction it can lead to inflammation, is not it, and because of infection it can lead to this because of infection it can lead to fever. So all this problem, like he or she can have. But but what type of disease he will have that doesn't show any sign of fever? He doesn't have, he does not has any sign of fever or any other previous history of abdominal pain. Previous history of abdominal pains means like before before he never used to have abdominal pain. And what will be your line of presumption should be, is he suffering from renal stone, or if he have urinary tract infection, or else he have urinary like urinary tract obstruction, or else none of the above. So the given option is option A. Okay, why this is option A, I would like to explain little bit briefly. So the renal stone is the answer. Okay, this was your Shaban man part. I think renal stone, isn't it, Srijana? Renal stone was taken by Shaban man, isn't it?
Yes.
Yes. So why this, like why you did not choose all this urinary tract obstruction, and why you did not choose this urinary tract infection? So because in urinary tract obstruction and infection also, there used to be a back pain, is not it? And their lower part of the abdomen used to pain, and then all this problem they used to have. But the only reason why this option A is correct is that the person will not show any kind of fever. That is why, like, there no symptoms used to be shown, okay, in this renal stone. So that is why this option A is correct. So let us repeat again. So if a person comes to you with pain in his abdomen as well as in his back, and the pain is so much like severe that it radiates to the lower abdomen, and then he also will have his frequency of urination also will increase, but he will not show any sign of fever or any other previous history of abdomen pain. So if this is the case, then you can presume or you can assume that a person suffer from, like, or a person have renal stone. So that's all about our today discussion. So till today I have given you all from 1 to 121 question. So yes, 1 to 121 questions. So this much question are very important. You don't know which questions will be given in the exam, but try to have the idea of all this. And whatever I used to send, don't just like keep it in your phone as a like PDF. Try to write it down. So all of you, are you clear? Whatever we have discussed today?
Yes,
Yes,
ma'am.
ma'am. Yes, ma'am.
Okay, all of you used to write down the question, or just you used to keep in your phone? You used to write down or not?
Yes, ma'am.
Yes, ma'am.
All of you? All of you?
Yes, ma'am.
Yes, ma'am.
Keep on writing down all this, okay? There will be one day that I will be checking this. So, and I won't tell you all the day that I will be checking on this day. Suddenly, like a surprise test, I will check the questions, whether you used to write or not. Nothing will be benefit to me. It will be the benefit of you all only. I have given the question, and the means just the solving or how to handle or how to by heart the questions. Everything is up to you. That will help you all in your final examination. So tomorrow I will see. Okay, tomorrow also, like, I am very much busy, like I can't exact say the timing. Okay, so I will be like informing you all again by tonight. I will inform you all at what time I will be taking, because nowadays meeting is going on now. So I used to be very much busy the whole day. That's why. So if I give any time, morning 8:30, 9:30 also, like, don't face any problem. Okay, it's just for you all only, whatever class we have taken. So all of you just study hard. Okay, your final exam is very near. The routine are setting now. Okay, it's almost out. Circular is almost out. As soon as it is out, I will send you all. So all of you, you're clear with today class, is not it?
Yes, ma'am.
Do you feel
Yes, ma'am.
do you feel nice discussing from one question to 120 something question? Yes or no?
Yes, ma'am.
Ma'am.
Okay. Okay, then.
Ma'am,
Yes.
ma'am,
Yes.
ma'am, in the last PDF, number 79 is blank.
Oh, yes. That 79 is blank. Okay, there is no question. Okay.
Okay,
And
ma'am.
it's like by setting, I said it by mistake. Okay. There is no
Okay,
problem.
ma'am.
Okay, okay. Okay, then have a nice day, everyone. Thank you.
Thank you.
Thank you, ma'am.
Okay, ma'am.